everyone, welcome to my channel. Today I am going to deal with the subject that is the foundation of nursing. So in this class we are going to study about the introduction to nursing. As you all know that we are the nurses who are very responsible for the taking care of the persons or the patient. So it is our duty to know what is our profession, what does our profession says, and what are the roles and responsibilities, what are the characteristics, and what is the term nursing comes from and what it defines. So today first we are going to start with the meaning of nursing, that is our profession nursing, from where does the nursing word derives from. So the word nursing is been derived from the Latin word which means nutrix, is nothing but the nourish, to nourish. So after the definition of nursing, as we all know the definition of nursing, it is I have taken two definitions, that is one from the Virginia Anderson and the other one is from the Florence Nightingale. So what does Virginia Anderson definition states? So the definition states that the unique function of a nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to a peaceful death that he would perform unaided if he had the necessary strength, will or knowledge. It means that the unique function of a nurse is to assist. The unique function is nothing but the main function of a nurse is to assist the individual, sick or well, whether he is individual or sick or well, in the performance of those activities contributing to health. In the performance of those activities is nothing but these are the activities which helps in contributing the health, to improve the health of the patients or to its recovery or to get to recover from the diseases condition or to a peaceful death. When it applies, when the patient is in the last condition or the palliative care in the chronic illnesses, that he would perform unaided, means that he would perform unaided in nothing but without the help of the others. And if he had the necessary strength, will or knowledge, if he had the necessary strength, will or knowledge, how the person will be able to take care of his all day living activities, that is the main it implies. It means that it focuses on the independence, means how we are going to, when we are not ill or not sick, when we are how we are going to perform the all day living activities without the help of the others. In the same way, this theory also implies focuses on independence. So again, second is nothing about the, according to Florence Nightingale. So as we know that the main pillar for our nursing is the Florence Nightingale. She is the one who has given the name, the nursing, and the scope for the nurses. So Florence Nightingale, before knowing going to the theory or the definition of according to Florence Nightingale, we will study about the Florence Nightingale contributions. That is nothing but we know that Florence Nightingale, she is the one uh, who has been who has the birth of the Florence Nightingale was on May 12th, 1820. That is May 12th, 1820, and the death is died on August 13, 1910. So on every year, on May 12th, International Nurses Day is celebrated. These are the contributions of Florence Nightingale to the nursing. That is birth on May 12th, 1820 and died on August 13, 1910. On every year, May 12th, International Nurses Day is celebrated, and she is known as Lady with Lamp. Why she is known as a Lady with Lamp? Because she is the one who cared the soldiers at the time of Crimean War, which took place in the year 1853. With the help of a lamp, she took care of the soldiers at night. So she is known as the Lady with the Lamp. Where at the time of Crimean War, which took place in the year 1853. So this is the contributions of Florence Nightingale. So What is the main Nurses Day theme in the year 2025? As we know that our nurses, the theme of the Nurses Day for the year 2025 is our nurses, our future. Caring for the nurses strengthens the economics. This is the theme of the Nurses Day. Okay. So according to Florence Nightingale, so other contributions of Florence Nightingale is that she is the one who has started the nursing programs or the training centers in the year 1860. After the Crimean War in 1860, she has started the nursing programs or the training programs. And she has also started the Florence Training School at London. So she was born on it was May 12th, 1820 in Florence, that is Italy. So according to Florence Nightingale, what is the definition of nursing states? It states that the art of utilizing the environment of patient to assist them in recovery. It means that the Florence Nightingale focuses on the theory or the definition of Florence Nightingale focuses on environment. Means the patient's environment plays a very important role in the recovery of a patient. The environment may be the physical environment, the psychological environment, okay, the social environment, the mental environment, physical environment, the social environment like the society, family, friends, everything, mental environment, the mental status of the patient, or the physical environment, the body appearance, the body, everything. So that is mean the definition of Florence Nightingale. Aim depends upon the environment. Here environment plays a very important role in the patient's recovery. So next coming to the characteristics. So here comes to the characteristics. That's what are the next topic is the characteristics. What are the characteristics of nursing or the nurse? So what are the characteristics of nursing or the nurse? So what are the main characteristics as a nurse? What are the characteristics we should possess in nurse so that it will be very helpful? First comes the she should be educated. She should be a caregiver. She should have the scientific knowledge. She should have accountability. She should have fidelity, versatility, she should be critical thinker, she should be knowledgeable, she should be compassionate, she should be honest, then respectable and decision maker. These are some of the characteristics of the nursing. So as a nurses, what is it educator? She should have the knowledge about, and then she should educate the patient regarding the health condition or the diagnosis. Caregiver, she is the one who gives the care to the patient. Okay, scientific knowledge. Scientific knowledge nothing but this, she should have the knowledge regarding the anatomy and physiology of the structure or this anatomy and physiology of the disease condition so that she can easily diagnose or state the easily state the problem. Accountability is nothing but she will be accountable to the work what she has done. Fidelity is nothing but the should be faithful, and she should maintain the confidentiality and privacy of the patient. In some cases like HIV, TB, cancers, what happens? The fidelity of the patient should be maintained. Versality is nothing but truthful. Truthful in the sense she should be very truthful to give the information to the patient about the disease condition, about their diagnosis. What is the diagnosis of the patient? She should say it. She should make them understand what is the diagnosis. Each and everything she should clarify. That it should be very truthful. Next, critical thinking. She should be very much alert and should think critically. Is nothing but she should have that decision making capacity. At the time of emergency, what happens? She should act uh, quickly. That is nothing but the critical thinking. Knowledgeable. Of course, you should have the knowledge regarding the uh, disease condition or the topics. Next, compassionate. That is nothing but the honest. She should be very honest. She should be respectful. She should have a decision making policy. She should be very humble. Okay, these are the nothing but the characteristics of a nursing or the nurses. So next come to the ICN Code of Nursing. That is nothing but ICN, International Counseling of Nurses. What are the code of ethics? Ethics are nothing but the rules and regulations which has to be followed by each and every individual in general. But when it is related to nursing, it is defined as the rules and the regulations which has to be followed by a nurses in the profession. So this ICN International Counseling of Nurses was established in the year, was found in the year 1899. ICN is nothing but the International Counseling of Nurses. Council of Nurses, which was found in the 1899, and this code of ethics, that is a sets of rules and regulations have been organized and framed in the year 1953. So what are the code of ethics? It defines nothing but the nurses and people. It has four uh, objectives in this, that is nurse and the people, nurse and practice, nurse and profession, and nurse and co-workers. These are the ICN code of ethics. Here next comes the responsibility of a nurse. Responsibility of a nurse. So what is the main responsibility? The main responsibility of the nurse is first to promote health. To promote health. How she can promote the health? With the help of strategies like IC, information, education and communication, by formation of groups and giving the IECs like information education about the materials. For example, showing the visual and audiovisual aids related to smoking, tobacco and cancer. So what happens when we smoke? What happens? It may lead to the cancer. Each and everything she can help the promote the strategies like giving IEC. How she can promote the health by giving IEC, information, education and communication. Next, behavioral change communication. That is the BCC. Nothing but the behavioral change communication and formation of groups. With the help of groups, she can promote the health. Next is to prevent illness. How she can prevent illness? The prevention of illness depends upon three steps. That is the primary prevention, secondary, and then tertiary. Primary prevention is that prevention which takes place before the occurrence of the disease is known as the primary prevention. At that time only we can prevent the health. Secondary prevention after the occurrence of the disease. Tertiary at the last stage of the disease. To prevent illness, what happens at the time of before the disease occurrence? Then what are the steps we have to take? That is nothing but the prevention, preventive illnesses. That is like before the occurrence of the disease, we had to do walking or quit this smoking, alcohol, bad habits like walking, exercises, yoga, meditation. These are the methods come under the preventive illnesses. Third is to alleviate suffering. alleviate suffering is nothing but to less down the suffering of the patient. This is nothing but the responsibility of a nurse, and even to cure the curative measures for the disease. Curative measures nothing but the what are the preventive measures has to be taken to prevent the disease. So these are nothing but the topics which should to be covered in the introduction to nursing. First, I have covered about the meaning. What is the meaning of the nursing? The definition. Two definitions have taken. One from according to Virginia Anderson, and other is from the Florence Nightingale. Again, what are the characteristics of nursing profession or a nurse? Then ICET code of ethics. What are the ICET code of ethics? Then what are the responsibility of a nurse?